Hello, everyone, and welcome to Nature and Science Podcast. I'm your host, Don Murphy. Joining me on this episode is Jessica Ostheim. Jessica is a clinical dietitian at the University of North Carolina Rex Cancer Care Center. She received her master's in nutrition science from Arizona State University and her bachelor's degree in nutrition sciences from Penn State University. She specializes in helping oncology patients with their dietary needs during cancer treatment. And I can certainly testify to that because she certainly helped me during my successful cancer treatment. We're going to explore what inspired her to become a nutritionist, why nutrition is important for cancer patients, and what role nutrition plays in cancer prevention. So let's get started. Jessica, welcome to Nature and Science Podcast. We really appreciate having you here. This is Jessica Ostheim, and you don't mind me calling you Jessica, I'm sure.
No, perfectly fine.
And we've gotten to know each other over the past several months because you served kind of as my nutrition. I felt you were my personal nutritionist.
Oh, well, good. I'm
well,
glad
you
you
showed
felt that
such,
way.
care and concern. You'd always call and, ask how I was and what was going on. And so I'm really anxious to talk to you about nutrition and cancer and hear what you have to say about that. So we can go ahead and get started. And I'll be referring to my notes every now and then, and I think you have some notes too, so we kind of stay on topic here. But let's start off with what inspired you to get involved with being a nutritionist or a dietitian in the first place. Was there something in your youth or childhood that inspired you?
Yeah, well, first of all, thank you so much for having me. It's great to see you on this side of things and to be able to talk through something I am passionate about. So as far as that goes, what got me interested in this field is actually my mom. I know it sounds kind of cliche, but when I was growing up, my parents were very focused on education. They never focused on, after high school, just do whatever. It was always, you're going to go to college and, try to find something that you're interested in. And growing up, that was always in the back of my mind as I got closer to 7th grade, 8th grade, getting into high school, starting to think about which colleges do I want to go to? What am I interested in? I didn't really know. So I figured, okay, well, my parents are focused on this, so maybe they have some ideas. So I was talking to my mom. I don't remember exact details of it, but I remember I approached her and just said, I don't really know what I want to do. I don't know what I'm interested in. I don't know what I would want to study. And she had shared with me that if I could go back and if I could do all of this again, I would want to be a dietitian. I had never heard that word before. So I asked her, I was like, what's a dietitian? What do those people do? And she had shared a little bit with me about that and her reason for wanting to do that. And after that, I kind of thought on it, and she really modeled that in my childhood. I joke now with friends and family that growing up, if we had Pop-Tarts, they didn't have frosting on them. We had Lucky Charms only on St. Patrick's Day.
Right.
She was very focused on having healthy meals, limiting added sugars, just making sure that we had the foods that would nourish our bodies. So she really emulated what she had been passionate about.
Well, that's interesting because our younger children remind us to this day about how strict we were about diet and not letting them eat candies and sugars and that sort of thing. I don't think they had any candies or sugars until they were much older. So I can definitely relate to your mom.
Yes. So that's what got me interested in it. And once she shared those things and I thought about it, I was like, well, that sounds kind of cool. So I went into college. I went to Penn State for undergrad, and I went into college with that being my major. And as we know, many people change their major throughout college, but I never did. It was something that I remained interested in and passionate about, and as I learned more about it, became even more passionate.
Yeah, no, well, that's really a great story. So you mentioned dietitian. So in the beginning, I want to maybe provide some clarity for our listeners and understand, is there a difference between being a nutritionist and a dietitian?
Yes, there actually is. So The dietitian community has now taken on the name of nutritionist as well. Previously, the community was a little against it or kind of pushing back. And the reason for that is really anyone can claim to be a nutritionist. So anyone interested in food, interested in healthy eating can take on that term. There's even classes like online, you can get a certificate, things like that, and be a nutritionist, which is wonderful because we need people that are passionate that may not be able to, like a dietitian, you need to have formal training and schooling for that. So that includes having, you don't have to be, that doesn't have to be your major in undergrad, but there are core classes that either in undergrad or a graduate program you must complete. And then you have to do a certified practice, similar to nurses doing clinical. We have to have at least 1,200 hours of practice that we're overseen by a dietitian. And then at the end of that, we take an exam. So we take our registration exam, kind of like doctors take their MCAT or take those board exams, very similar. And then you're a dietitian. So it all comes down to the schooling that someone has related to the field.
I see. So there is a difference between the level of education between a nutritionist and a dietitian.
There is, yes.
I understand.
But dietitian is a word that many people aren't familiar with, so that's why the community has taken on, like, people know nutritionists. They know that word. They know it deals with nutrition. So let's embrace it, and as long as we're reaching the people that we need to, that's the important thing.
Right. But if someone comes to, but I see that there could be a potential conflict, because if someone is looking for someone that has detailed scientific information based in biochemistry and physiology, it would be different between a nutritionist and a dietitian.
Right.
So how does someone who is seeking advice and wants some certified advice, if you will, or someone that has professional advice, how do they make a determination between whether or not that they're talking to a nutritionist or a dietitian that's trained?
Yeah, great question. So looking at someone after their name, as many of us do in the medical community and other communities too, those credentials, those letters behind someone's name, if you see the letters RD or RDN, which stands for registered dietitian or registered dietitian nutritionist, then that's someone who's had that formal training. If that's not there, then they haven't, which again is fine. But if you're really looking for that person who is trained in that, has had the schooling, looking for those, can also reach out to your providers. So whether that's your general practitioner, if you see a gastroenterologist, any kind of specialty that you see, you can always chat with them and ask them to refer you to a dietitian.
Well, that's good information. Yeah. So let's talk a little bit about cancer, which is what you seem to be focused on. Yeah. So why is nutrition and your diet important for cancer patients?
Yes, so nutrition plays a huge role throughout the process, both before treatment, during treatment, and even after treatment. I often like to tell people this whole process can feel really out of your control, and nutrition can be the one thing that you have control over. It's the one thing that you can dictate, that you can truly do something about. With that, nutrition is the best way that we can support our bodies, again, through that process that we feel so out of control of during. With proper nutrition, can maintain strength, maintain weight, even those lab values can be manipulated by proper nutrition. And by doing so, it can help us to stay on track with our treatment plan, feeling as good as possible throughout treatment, and having that quality of life, which is so important for all of us. Another component of that is with meeting nutrition needs, the body can heal between treatments in order to feel as good as possible. We can really see that with radiation. So with radiation, those skin cells are kind of like a severe sunburn. We can get that kind of process. So having proper nutrition, especially fluid and protein intake, can help those cells to heal and for us to be able to maintain our quality of life because of that.
Right. Well, what about micronutrients? I know in many cases that's extremely important because a side effect sometimes of chemotherapy and radiation can be a reduction in some of those micronutrients. So how does nutrition and diet play a role in maintaining the right levels of some of those micronutrients?
Yes, so it definitely does. So with those micronutrients, of course, we're referring to vitamins and minerals. So a big one, or I guess I should say two big ones, are sodium and potassium.
Right.
Those are ones we often see are getting high, getting low, and that can be an effect of treatment and also something that we can have an impact on. So some of those side effects like nausea, vomiting, diarrhea, constipation, not taking in enough fluids, which can stress out our kidneys a little bit, so they can't filter as well. So focusing on those foods that are higher in those nutrients, getting enough fluid in can help with those lab values.
Well, I know you mentioned potassium, and that's important for heart function as well, isn't it?
Absolutely.
Right.
Yep. So too high or too low can make our hearts work harder than they really need to.
Right. So it's important to. So what kind of foods, particularly for cancer patients, are important when it comes to micronutrients and just overall health?
Yeah. So with that, are you looking at one of these questions? Sorry, not to interrupt.
Oh, no,
but,
it's okay.
can you re-ask the question?
Oh, sure. No problem. Besides, we do a lot of editing on this. I was just wondering, are there particular foods that are important when these are for these micronutrients when you're talking about potassium and sodium and even other ones? And to maintain hemoglobin levels, their iron levels for patients. Are there particular foods that you end up recommending that people pay particular attention to?
Yeah, so we had talked a little bit beforehand about like the food pyramid, and more recently there's been My Plate, and now there's the New American Plate. So focusing a lot on plant-based foods, and those are where we find a lot of those nutrients that we see those changes in lab values with, particularly potassium. So I do like to encourage people that we need to get in those fruits and vegetables. I love the fact, because I love potatoes, I love the fact that
So do I.
potatoes, yes,
Right.
are our highest source of potassium. Often people think of bananas, and that's what's recommended, which they're the second highest, so still a great option. But potatoes are high in potassium. They also have some magnesium, which for some people can get low as well.
Right.
Our nuts and seeds are also a really great option because they provide pretty much everything we need. They have those micronutrients, they have some fat, and they also have protein. So really focusing on those plant-based foods is what's going to help us the most.
Understand. Well, you know, the internet has good information and bad information.
Sure.
And a lot of people go to the internet immediately when they get a cancer diagnosis to both find out what type of cancer they have and what they can do nutritionally. And some even go to find out if there are alternative treatments. And a lot of these alternative treatments involve nutrition and dietary supplements and changes. So a couple of questions related to that. What do you tell patients if they ask you, you know, can I be cured if just by changing my diet, for example? Or how do you advise them when they're, you know, surfing the web and finding out all of this information? And they may even challenge what you say. Well, I saw on the internet this, that, and the other. And so what about it? How do you respond as a dietitian?
Yeah, so I like to remind people that if it seems like a simple or black and white fix to something, there's probably more to it than that. That unfortunately with a lot of areas of life, there's not a quick and easy fix. So if it seems like it's really simple, like, oh, just cut out this one thing and you're good, there's probably a bit more information to that. The things that we hear as dietitians in the oncology realm the most are about sugar feeding cancer. And while that is somewhat true, carbohydrate is a very complex word for sugar. Carbohydrates are what our bodies use the most for energy, especially our brains. So it is really important to have those carbohydrates or sugar in order to fuel our brains and feel as good as possible, not have that foggy headedness. With taking in any kind of nutrition, we can't say, okay, sugar, you go to these cells and not to these other cells, or okay, protein, you go to these cells and not these other cells. So while we don't want to have a lot of added sugars, a lot of those high added sugar foods and beverages, we do still need sugar in order to fuel our brains. So it does feed the cancer cells, but it also feeds all of our healthy cells too.
Right, absolutely. And from what I understand from my days in graduate school and in physiology and pharmacology, of course, 50 years ago, I'm retired now, but I think where a lot of this misinformation comes from is that people end up conflating things because they hear that cancer cells, for example, use a lot of sugar, a lot more sugar than normal cells do. And in fact, when you get a PET scan, that's what the scan is looking at is the sugar utilization between normal cells and cancer cells. And I think what's happened over time is people have conflated things and said, oh, well, if I don't eat as much sugar, the cancer's not going to grow. And that's just not the case. It's much more complicated than that, and I think that's why it's dangerous to sometimes go to the web and find out information when it's not, it may not be accurate. And now it's a little bit even more serious because you have AI that you can, and chatbots that you can just ask questions to. And I just recently had the experience of a chatbot just lying. And when I say lying, I'm not being hyperbolic. It's not hyperbole at all. The chatbot admitted that it was fabricating some information. I was doing some research on neurology and the effect of silence on the human brain, and it conflated this whole thing and gave me a whole bunch of misinformation. But because of my background, I said, no, this doesn't sound right. When I challenged the AI, it came back and said, oh, I fabricated this information and I shouldn't have.
Right.
And so so now that we have AI, I'm sure there must be patients that come to you or may come to you and say, well, I had a chat with the AI and I got this information. Have you had that experience yourself, or?
I haven't yet, although do anticipate that will come up in the future. And to your point, that if we're someone who knows more about that topic, we might be able to disseminate, okay, is this accurate? Does this seem inaccurate? But if we don't know much about that topic, and that's probably why we're using these types of resources, is because we don't know and because we're wanting more information. And if it seems like, oh, well, that's a well thought out response or something that seems like it makes sense in some way, that people will latch onto that and take that as fact. So while I haven't had that, I still have had people kind of conventional, just Googling, looking on different websites, different blogs, things like that. So I do like to encourage people, there is a lot of great information out there. There's a lot of information that isn't fully true or isn't the most reliable. So referring back to your dietitian is a great place to start. Also looking at those websites that we know provide research-based evidence. Some of my favorites as far as the oncology world goes is the American Institute for Cancer Research.
Oh, good.
They have a lot of great information, a lot of great resources, including some information on plant-based diets. I have a pamphlet that I love to give patients called The Cancer Fighters in Your Food.
And I think you have some of those pamphlets there with you, right?
I did bring those with me just in case wanting to look through. But so they're a great resource. They also have some really great healthy recipes on their website. So if people are wanting to experiment or look at some recipes that may fit into what they're looking for from nutrition, that's a wonderful resource. Also, the American Cancer Society, their website is great as well. And kind of back to your point about with complementary medicine or herbal supplements, things like that, Memorial Sloan Kettering has a wonderful app. It's called About Herbs, and it has pretty much every herb and plant-based medicine that you can think of. You can look on there, see, does it interact with medications that I'm being prescribed? Is it harmful in any way? Is it something that might be okay? Just to be able to have a better resource for that if it's something that someone's interested in and that is very scientific based and appropriate information. We're also very fortunate here with UNC that we have a nurse practitioner in the integrative medicine space who is a wonderful resource for things like that as well.
Yeah, she's really good. Yeah.
Yes. So did you have an opportunity to speak with her?
Yeah. Mm-hmm.
Good.
Right.
Yeah, she's wonderful. I refer to her all the time.
Oh, that's great. Well, you mentioned herbal use and supplements, which brings to mind, and I hadn't talked to you about this before, but there's always been this talk of the difference between Western medicine and Eastern medicine, and Western medicine often gets a bad name because it seems to be pharmacologically based as opposed to plant-based or herbal-based, and so a lot of the alternative types of treatments that are out there or that are sometimes touted for cancer come about because people have this, I guess, idea that Eastern medicine is better than Western medicine or vice versa. Have you run into that in your practice? I mean, do people come to you and say, well, I hear that, the Chinese do this or that Asian medicine does this? And what do you say to people when they bring up that kind of thing?
Yeah, so definitely have had that experience. I do often encourage, or always encourage patients to talk with their providers and to share what their interests are, what they feel comfortable with, because that's so important throughout this process to be an advocate for your beliefs and what you feel comfortable with and what you want for your body. So having those open conversations, I like to view them as complements to each other, at least from a nutrition standpoint, that sometimes we need kind of using supplements as far as like a calcium supplement, things like that, as quote unquote Western medicine in a way, versus our whole food based calcium. So getting things like broccoli and some of those nuts and seeds to get some calcium, that they can work together. So there may be times, and I say this to patients all the time throughout treatment, that at different points we may need to prioritize different things. So there's a time where we might need to prioritize one thing for a certain reason, and then treatment shifts, side effect shift, things like that, that we might need to change our priorities. So using them in tandem, I think, can be really helpful and make people feel heard that what's important to them can be integrated too.
No, I think that's a good way to respond to people, because I think now more than ever people want to feel like they're in control of their bodies and their health, and certainly want to have a say. And a lot of times they do have information that their physician may not have, and it's a good thing to have that give and take in that dialogue.
Absolutely.
So glad to hear you say that.
Yeah.
In my recent conversations with oncologists, it was very clearly communicated to me that some of the causes of cancer could certainly be prevented if people behave correctly, and that involved everything from the right kind of diet to lifestyle, and that we wouldn't have as many cancers in our society if people, for example, ate right, which is what we're talking about. So when you're talking about eating right and in the preventative space, what do you tell patients as a dietitian?
Yes. So with that, there are certain cancers that our food choices and our overall body composition, it can be a determining factor. So the biggest ones are colon cancer, breast cancer, and prostate cancer. that maintaining a healthy body weight can be a factor in preventing those cancers or reducing the risk of developing those cancers. So going back to the New American Plate and that plant-based diet primarily, that comes from the American Institute for Cancer Research, and one of their points on that as far as animal-based products is with red meat. So with that, we want to limit to 12 to 18 ounces of red meat as a maximum per week, also limiting those added sugars. And with that, that can really help with maintaining a healthy weight overall and helping to limit or prevent those types of cancers.
I know for a while there was a lot of talk about nitrates, nitrites in food. Is that still a concern in terms of those particular biochemicals being carcinogenic?
Yeah, great question. So there isn't as much focus on that more recently, just as we continue to do more research. A lot of those are found in animal-based products, though. So it kind of goes in line with those recommendations to focus more on plants, focus a little less on animal products, especially that red meat.
I understand. So do people come to you frustrated, though, sometimes as a result of hearing all of these different reports, whether it's on a podcast like mine or some other news source where this particular biochemical or this particular food or this particular kind of chemical in the environment is carcinogenic, and there's just a plethora of them out there. So it's very confusing for people. So as a professional, what do you say to people when I'm sure they come to you confused sometimes about all of these things?
Yes, absolutely. So I like to start out by validating their concerns, that that's something that does make them nervous or scared or whatever emotion they may have with that. So validating that and then reminding them that there are many factors that contribute to our overall health. So while looking at some of those food-based options and choices is really important, that even if we make all of the quote-unquote right choices and avoid all of these things that we hear that we need to avoid, we still may develop a disease, including cancer. That there are environmental factors, like you mentioned. There are genetics at play. So wanting to, for the most part, as much as we can, because often when we hear of those carcinogenics, a lot of them, you may have heard recently about dye number 3, that's being banned because it's been
and that's red dye number 3.
Yeah. That it's being banned because of its link to cancer. So a lot of those things that often are banned are additives to foods. So if we're focusing as much as we're able on those foods that limit additives, can be a great place to start.
Well, interestingly enough, I don't know how far it goes back. I mean, I remember not long after getting out of graduate school that red dye came up. I mean, it's been researched for decades.
Yes.
And so it's interesting that it's taken decades to get to the point where it's finally being banned.
Right.
And it just points out how complex biochemistry is and how complex our bodies are, which leads me to have to make the point that there are many different types of cancers, and they're affected differently by our behavior, by our environment. And we're talking about, of course, nutrition and diet. And some cancers aren't related to diet or nutrition at all. Isn't that correct?
Right, absolutely, yes. So even, like I said, if you make all the quote-unquote right choices, may still be something that shows up in your body.
Right. But are there foods that you would definitely say, in your experience or that you learned in your education, that are definitely carcinogenic?
So those additives, like I mentioned, having a lot of added sugars in our diet, not only for cancer, but other things like cardiac health, development of diabetes. So where we're able, limiting those added sugars, although kind of catch-22, like I mentioned before, sometimes needing to prioritize certain things at different points in our lives. And then trying to limit where we're able to with those plant or those animal-based products.
Right.
So I do like to focus we don't need to be vegetarian. Those plant-based options can be really beneficial.
Right, no, I understand. Well, you mentioned vegetarian and vegan, and I'm really interested in knowing as a dietitian, because you hear vegans, vegetarians tout that it's a healthier diet. What do you think?
Yeah, so I think it depends on the person. It also depends within that what other food choices they're making, right? So even if you're vegetarian, doesn't mean you're only eating vegetables, doesn't mean you're only eating fruits. So it can be based on the other food choices that you're making outside of those that you're limiting or avoiding in some way. I think for some people it can be a good stepping stone if they're wanting to make some healthier choices in their diet, as long as they're going about it in a way that aligns with their goals. And then also touching base with a dietitian, making sure that you're still getting those micronutrients. There's certain micronutrients, vitamin B12 comes to mind, that we can only get from animal-based sources. Can get it some from some dark greens, some seaweed, things like that, but not in a quantity. We can't eat enough of it to get the amount that we need. So it's really important if someone's looking to be vegetarian or be vegan, that they're knowledgeable about those diets and also talk with their providers and a dietitian in order to make sure that their bodies are being well supported.
No, I understand. Those are really good points. Let's take a break here. Anna, you can stop the camera for a second.
Alrighty.
Because we're almost.
Alrighty, it's recording again.
So Jessica, when it comes to the psychological well-being of patients, I know there are a lot of things that people practice in meditation and mindfulness and that sort of thing. But is there anything they can do nutritionally or with their diets that would help psychologically as well?
Yeah, wonderful question. So throughout treatment, mental health and emotional health is so important, and I'm so glad that people are bringing more light to that, because I think for a long time that was put on the back burner a little bit, and now it's being brought to the foreground, which is fantastic. I'm a big proponent of mental health, so I think nutrition can play a role in that. As I mentioned at the very beginning, that nutrition is one thing that people have control over in this process that feels so out of their control. So knowing, okay, I have the choice to eat or not, and that's going to make me feel better, that's going to give me strength, that's going to make me have those carbohydrates, those sugars that help to feed my brain so I don't feel so foggy-headed, so I can interact with my children, my grandchildren, my friends, walk my dog, do all these things. So making that choice to eat, and then having those foods. I do not like to think of foods as good or bad. I like to think of them as which foods help me and support my overall health, and which foods are neutral, that they don't really help my body that much. Maybe I like them because they taste good or they bring some joy, which is also very important. It's really important to have that joy through eating. But having those foods that contribute to our overall health more often can help with our mental health. So I mentioned a little bit kind of off mic there, but with having foods that are really high in added sugars, we often see those blood sugar spikes and then a quick drop, which can make us feel really tired, can make us feel even worse. So trying to limit those as our go-to foods, just because they do tend to give us that temporary fix, that temporary high, and focusing more on things like fruits and nuts, trying to get some carbohydrate and some protein each time we're eating, help those blood sugars stay stable, help us feel like we're doing something to support our bodies and getting them those micronutrients that they need.
All right. And you mentioned feeling a little bit high and feeling good from eating, but it does lead me to ask about the final thing with respect to nutrition and diet. We already talked about herbs, but we didn't talk about TCH. Does that come up in your discussion dietarily with people? Because in the cancer community, people talk a lot about marijuana use making them feel better psychologically. I say TCH because it's a biochemical.
Right.
It can be seen as a nutrient or herbal nutrient in a way, and it's something that's discussed a lot. Some doctors prescribe it,
Right.
so I don't know if that's come up in your discussions with people. Do they ask you about it and ask you should they perhaps look at using TCH as a supplement during their cancer treatment?
Yes, so I have had that question somewhat often, and I always appreciate when people ask, because I think for some people it can be a bit taboo or bring some embarrassment or just bring about some emotions or not wanting to be looked at a certain way. So I always appreciate when people feel comfortable and safe enough to ask me that. That lets me know that we have good rapport with each other and that I'm a safe space for them. When they ask me that, it is outside of what I'm able to discuss, outside of my scope. I'm not able to prescribe it, not able to give my opinion on it. So I do let them know, thank you so much for asking me that. That's a wonderful question, and I encourage them to talk with their provider to let their provider know that it's something that they're interested in and wondering if this is a way that they can complement their treatment. So I always refer back to their provider, but very much so welcome the question.
So that's really kind of no different than any other pharmacological drug that someone might want to use for their cancer treatment or choose to find information about.
Absolutely.
And it would be best if they find that information out from their provider.
Yep,
Is
absolutely.
what you're saying.
Absolutely.
So what does the future hold for you? Are you going to do this the rest of your life, or are you going to say, gee, I want to become an oncologist and I'm going to go back to school? What does the future hold for you, Jessica?
No more schooling. I love to learn, but after I got my master's, I was like, that's enough of formal schooling and doing tests and all of that. Love to continuously learn. So I worked in the inpatient space for almost 10 years. Absolutely loved it because of that. I learned something new every single day. And with oncology, over time, I found that it was a population I was very passionate about. My family on both sides has a history of cancer. And so it's a population for quite a while that I felt very called to give back to and to serve in some way. So because of that, no future plans to leave oncology space, but would like to continue as a dietitian to support people. I love to get to know people as a person, not just a hospital room number, not just as this person I see once, but really getting to know them as a person and their support people and being able to support them in a way that I can. So sometimes when I visit with them, that's not nutrition related, and that's okay.
Right, understand. So, final question, is there some experience that you had that you would term as transcendent in your interaction with cancer patients? Has something ever happened to you in your interaction with patients where you feel like you either grew or became a different person or got an insight that you didn't have before?
Yeah, that's a great question, and I might even have to think on that. But there are patients, as for all of us, that you seem to bond with a little bit more. And that's the case in all of life, right? That certain patients, they kind of push you a little bit more or they inspire you a little bit more. So have definitely had those interactions. But as far as like one pinnacle thing that it really changed my practice, I'd have to think on that. I know that there are, but just can't think of it on the spot.
That's okay. Well, and you can get back to me on that.
Yeah.
How's that? Well, Jessica, thank you for joining us on Nature and Science podcast. I really appreciate it. Not only that, you talked about appreciating human beings. I appreciate you as a human being. I appreciate getting to know you and the care you showed during my treatment, which is now over and, of course, successful.
Which is wonderful.
And it was very great to get to know you. And it's other people that I know in my sphere who have unfortunately had experiences with cancer are really looking forward to hearing from you and hearing this whole series that we're doing on cancer. So thank you for joining us. I appreciate it.
That's wonderful. Well, thank you again. And like I mentioned, so good to see you on this side of things and know that you're doing better. And I always tell people, I hope to see you again, but not back here.
Right, exactly. Well, thank you, Jessica. Thanks everyone for joining us. This concludes our series on cancer. In our next episode, we're going to switch things up and talk about nature and the environment. We're going to take a look at the ambitious program called 30 by 30, which is to preserve 30% of the Earth's biodiversity by the year 2030. We're also going to take a close look at climate change and try to figure out exactly what it is and how it differs from just ordinary variations in the weather. So you won't want to miss those episodes. If you enjoyed these series on cancer and you're enjoying the podcast, please hit that like button and also subscribe to the podcast at natureandsciencepodcast.com. As always, stay safe, share happiness, and remember, never stop questioning. Curiosity has its own reason for existing.